I'm Brooke.
I'm James.
Great.
We've been here about a year and a half.
Year and a half, yep.
Yeah.
Excellent. And what did you originally come in for?
Well, I came in because I'm a business owner and I'm under so much stress. I suffer big time from anxiety attacks and things like that, to the point of hospitalization, and I just didn't want to be put on normal anxiety medications, and so that's why I came in.
She was already coming to Dr. Williams, and I actually had a bout of severe pain on my side, and I went to the emergency room and they did an ultrasound and they said that I had gallstones. And I remember very clearly the ER doctor flipped me a card for a surgeon and said, if it gets any worse, we can remove your gallbladder and also improve your diet, and left me, just kind of booted me out. And I was like, oh, okay. And I got on the phone with her and she was like, we're not getting it removed. I'm getting you on a program with Dr. Caroline, and we're going to get this taken care of naturally, the healthy way, the right way. And in a few short weeks even, the pain was completely gone, got on a protocol, and still have my gallbladder.
Yes.
So.
Yes. Awesome. So, yes, and a lot of that was, like you said, Brooke was already a patient.
Yep.
And we'd been talking about, she'd been learning a lot about ways to support the digestive system. We
Right.
talked about gallstones are very common.
Yep.
What is it, like 60,000 gallbladders are removed every month in this country,
Right.
which is a lot.
Ton.
And yeah, very common issue. And in probably about 97% of those cases, the gallbladder can be rehabilitated.
Right.
And so we've been working on that really the whole time we've been together.
Yep.
And you have not had any other gallbladder
Nothing.
attacks. Yeah.
Nothing.
Some of the other things that you saw improve were just general digestion, right?
Right.
Yeah. So being able to eat foods and not have issues with those foods,
Yep.
right?
Yeah.
Like eating protein. You know, you had some problems with that initially, and
Yep.
we supported the upper digestion, and then you went through what we call a gut restoration
Yep.
process. It's feed and weed. It's another
Right.
name for it, and that corrected a lot of things. And we determined through that process that you had something called SIBO
Right.
that had developed, and there were reasons for that as well in your history that
Right.
that had happened. So and now you don't have any of those.
Nope.
No signs of that. So that's been great.
It's great.
Yes. So, and then for Brooke, like you said, a lot of what brought on the things that we worked on with you and determined was, like you said, stress.
Yes.
And one of the things that you learned was that stress affects your digestion.
Yes.
That you had developed an imbalance in your nervous system, which then also contributed to a balance in your endocrine system.
Right.
Put some stress on your liver, tremendous amount of stress on that, and so we've been working on that for quite a while as well.
Right.
And where would you say you're at now?
Oh, I am a million times better.
Yeah.
I don't feel the stress at all. I haven't had any panic attacks. My heart rate's not racing right and left.
Awesome.
And a huge thing is I'm able to handle situations now without having an attack.
Awesome.
Yeah.
Yeah.
Awesome.
Yeah.
Good. And you guys have learned a tremendous amount just about health in general.
Yes.
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 Absolutely. And we're working on, certainly we worked on what you came in with, but we are also working on preventing issues from developing, right? Because by not working on those things, it can kind of be a catalyst to a lot of other problems, right?
Right.
We kind of have learned that. So that's great. Well, I appreciate you guys being such amazing patients.
Thank you.
Thanks for being an amazing doctor.
Yes.
Ah.
I would never go back to
Nope.
another lifestyle.
Awesome.
Yeah.
For me, I mean, it wasn't too hard, I would say, nutrition-wise, because I already ate in
Pretty
the way
good.
that you suggest. But
Yes.
I recommend you to everybody, and I say
Yeah.
if you're looking for an alternative, or anyone that says they suffer from this or that, I say, here's my doctor's number, you have to call her.
Right.
So
Awesome.
then I leave it up to them, but I would
Yes.
never go back. So
Awesome.
I think too there's a big thing to be said, like, because I worked out 4 to 5 days a week. I thought I was on a great, my self protocol, whatever you want to call it. I thought, oh, I work out, I'm good, and I eat relatively okay. But man, and the blood work that Dr. Caroline does, it's not like the normal stuff that other doctors would pull. It's way more in depth. You see so much more on the blood work that gets pulled, and you can see like, no, there's a problem with some stuff that you're doing or eating and things like that. It's amazing.
And you don't think in your 30s that you could be
that close to being
like
diabetic
that,
almost. Like if you continue on this really poor diet of sugar and carbohydrates and things like that, even with working out, you can still have problems.
Yes.
So, yeah.
Well, and what you described is you can see early signs of developing things like a fatty liver.
Right.
Okay.
And that's definitely one of the fastest growing issues we have in our society. They call it non-alcoholic fatty liver disease. Even children are developing that today because of things like high fructose corn syrup that they're putting in a lot of foods today. Or they might be drinking regular soda and it's in there,
Yeah.
So yes, absolutely. We can see those things earlier so that we can prevent you from having major diseases and disease processes as a result of that. And then we're treating you as the person.
Yep.
So everything that we see, we're addressing, and we also look at from an imbalance perspective. Because your body is self-regulating, self-organizing, self-healing, that you have these two parts, these different systems, and they allow for that. And so when they're in balance, then you're going to be symptomatic. And the more out of balance, the worse you're going to feel.
Yeah.
So we just have a completely different approach in how we address these things.
Yep.
Yeah.
And I mean, for anyone that would say like, oh, it's like too hard or it's too this, tough luck. Like it's so worth it. It's so worth it. I can't stress it enough.
It's not hard if it's what you want.
Yeah.
Right.
And you're gonna have to be
right.
comfortable with being uncomfortable for a little bit. It is a change, but it's a change for the better.
Yes.
You know?
Yes.
And yeah.
Has it changed your perception about how you look at things when they show up? Like you had mentioned, kind of going through this process. Like doing the feed and weed, you might have some die-off symptoms.
Yeah.
But then once you get past that, then you're good.
Yeah.
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 And it's really, instead of looking at like, hey, how am I supposed to feel this way? This doesn't, this seems, because a lot of our society is based on symptom treatment, right? And so it's like, well, if I'm feeling, these die-off symptoms, how is this good? But it's actually exactly what needs to happen.
Yeah.
Right, and there's no real like freak out of, oh, I'm feeling this way, oh my gosh, what is happening to me?
Right.
You know what it is,
Yeah.
and it's explained by you.
Yes.
And you know that it's a good thing.
And you're also very good at getting back to someone very quickly. If you shoot you an email, hey, I just have this going on, you get an email back very quickly with, oh no, that's totally fine, or explain it a little further,
Or
it's great
you need to do
communication.
this.
Great
Yes.
communication.
Yes.
Awesome.
Yeah.
Well, and that's the concierge aspect, because the sooner we can address it, the better.
Yeah, and you don't get that from other doctors. They're
Right.
like,
Right.
good luck getting another doctor on the phone.
Yeah.
Yeah.
Well, and the system's just not built
Right,
that way.
right.
Yeah. So we're not part of that system.
Right.
But yeah, absolutely. You guys are committed to this, and I'm committed to you,
Yes.
and it's very much concierge in that regard. But the sooner we can address things, the sooner you're going to get better.
Right.
Yep.
So
Yes.
I encourage you guys to contact me whenever there's any kind of an issue.
Yep.
So
And we
I'm glad
appreciate
you do
that.
Yeah,
Yeah.
good.
Yep.
Well, I appreciate you guys, and thank you for
Of course.
doing
Yes.
Yep.
testimonial.
Thank
No problem.
you.
Yeah.